Legionnaires' disease outbreak in Harlem. 20 plus sick, 1 dead. A life has been lost, and over 20 others are battling illness as a result of a Legionnaires' disease outbreak that continues to unfold in Central Harlem. This news, reported by New York City health officials, paints a concerning picture for residents and visitors alike. And this is the part most people miss. Outbreaks like these aren't just random occurrences. They're often tied to environmental factors that allow harmful bacteria to thrive unchecked. By Thursday, the number of confirmed cases had climbed to 22, up from just a few last Friday, according to data from the city's health department. The affected area spans 5 zip codes: 10027, 10030, 1005, 10037, and 10039, which collectively cover much of Harlem, stretching between 116th and 155th Streets. While the death toll stands at 1, details about the deceased individual remain undisclosed, leaving many questions unanswered. Dr. Tony I. Sullen, Deputy Chief Medical Officer at the city's Department of Health and Mental Hygiene, emphasized the importance of early intervention. If you're experiencing flu-like symptoms, don't wait. Reach out to a healthcare provider immediately, she urged in a public statement. Why? Because while Legionnaire's disease can be treated effectively with antibiotics if caught early, certain groups face higher risks. Adults aged 50 or older, smokers, and individuals with chronic lung conditions need to be particularly vigilant. If they notice symptoms such as persistent coughing, fever, muscle pain, or shortness of breath, seeking medical attention promptly could make all the difference. So what exactly causes Legionnaire's disease? Well, it starts with Legionella bacteria, which flourish in warm water environments. When people inhale tiny droplets of contaminated water vapor, often from sources like cooling towers, hot tubs, or even showerheads, the bacteria can enter their lungs and cause severe pneumonia. In response to this outbreak, health officials have tested cooling towers on buildings within the impacted area. They've also mandated that property owners with affected cooling systems take immediate action, remediate the issue within 24 hours, and provide updates to the health department. Legionnaire's disease doesn't affect everyone equally. Most healthy individuals who come into contact with Legionella won't get sick. However, when symptoms do appear, they typically arise 2 to 14 days after exposure. These symptoms may include headache, fatigue, diarrhea, confusion, nausea, and difficulty breathing. For those unfamiliar with the condition, it might initially seem like a bad case of the flu, but failing to treat it properly can lead to serious complications. Interestingly, this isn't the first time New York City has faced a Legionnaire's crisis. Back in 2015, a major outbreak in the South Bronx claimed the lives of at least 12 people and left over 100 sickened. That incident served as a wake-up call for stricter regulations around building maintenance and water system management. Yet here we are again, grappling with another outbreak. But here's where it gets controversial. Some argue that despite increased awareness and regulation, more needs to be done to prevent these recurring incidents. Are current measures enough, or should there be even tighter controls on how buildings manage potential breeding grounds for bacteria? Adding another layer of complexity, weather plays a significant role in bacterial growth. Dr. Celia Quinn, Deputy Commissioner at the Health Department, explained to Gothamist last week that hot and humid conditions create an ideal environment for Legionella to multiply rapidly. With climate change contributing to rising temperatures and unpredictable weather patterns, could outbreaks like this become more frequent in the future? This raises an important question worth discussing. How prepared are cities and their infrastructure to handle emerging public health challenges driven by environmental shifts? According to the CDC, the national trend shows a steady increase in Legionnaire's cases over the past 2 decades, peaking in 2018. Locally, New York City sees anywhere from 200 to 700 cases annually. While these numbers might seem small compared to other illnesses, each case represents a human story, a family member, friend, or neighbor whose life was disrupted. As this situation develops, it's crucial for residents to stay informed and proactive. If you live in or near the affected zip codes or know someone who does, share this information widely. Encourage loved ones to monitor their health closely, especially during periods of extreme heat and humidity. And let's keep the conversation going. Do you think enough is being done to protect communities from diseases like Legionnaires? Or do you believe stricter policies are necessary? Share your thoughts in the comments below. We'd love to hear from you. New York Legionnaires outbreak. 1 dead, dozens infected. Harlem's health crisis. Legionnaires outbreak claims a life, more cases feared. Imagine a silent threat lurking in the heart of New York City, specifically in the vibrant Harlem neighborhood. This is the alarming reality as Legionnaires' disease has tragically claimed 1 life and left dozens battling for their health. But here's where it gets controversial. On a fateful Wednesday, local health authorities revealed the somber news of the fatality. Though they remained tight-lipped about further specifics, the origins of this outbreak can be traced back to July 25, a date now etched in the minds of many. Source: NYC Health Department. Initially, 22 cases were reported, but that number has ominously climbed to 30, according to the latest updates from the NYC Health Department. Source: NYC Health Department. And this is the part most people miss: the insidious nature of Legionnaires. Disease means symptoms can take up to 6 days to manifest after exposure. This Chanfuk period has health officials bracing for a surge in reported infections, as a spokesperson ominously hinted to Bloomberg News. The question on everyone's mind: how did this outbreak spiral so quickly, and what measures are being taken to curb its spread? As the community grapples with fear and uncertainty, it's crucial to ask ourselves, are we doing enough to prevent such outbreaks, or are there systemic failures at play? Share your thoughts and concerns in the comments. Your voice could spark the change needed to protect our neighborhoods.